have with us Dr. Shriram Nene, cardiovascular and thoracic surgeon, healthcare expert, and innovator. Hello, Dr. Nene. Thank you so much for taking the time for doing this interview as you share with us your insights on, the paradigm shifts in health and healthcare, as well as on the right mix of technologies and best health practices. Having said this, doctor, it brings us to one of the most dominant healthcare factors, healthcare risk factors, basically, cardiovascular diseases or, CVD, which is globally known to take an estimated 17.9 million lives each year. And out of every 5 CVD deaths, what we see is that 4 are due to heart attacks. So my first question to you, doctor, is that in the recent past, aging was established as one of the factors for heart attacks. I would say in the past decade, we see the younger generation, something in the age group of the 20s and 40s who are frequently falling victims to heart attacks. Why, in your opinion, has this, particular high-risk health hazard become so prevalent in the younger generation?
I think it's a great question. First of all, thank you for having me. It's an absolute honor and pleasure to be talking with you. You pointed out very well, 17.9 million deaths worldwide, 17.5 lakh people in India that we know about. And certainly coming out of the pandemic, we don't know how many more passed away. To your point, we've had some very high-profile youngsters succumb to this disease. And honestly, it's an interesting disease in India in that even as early as 2004, the journals were describing a different type of disease with triglyceride-rich milieu. So what happens with heart disease is it's oftentimes associated with family risk factors. It's also associated with smoking. It's associated with obesity, sedentary lifestyles, high pressure jobs, and stress. So you can't view it in just the context of one factor, which is age, but rather a whole myriad of different things which come together. And, honestly, it's a combination of genes and how you perform. Moving back to what you were talking about, the study showed that in India, heart disease hits 10 years younger than our Western counterparts. And it's a different type of disease with triglyceride-rich factors. And triglycerides are one of the fat transport vehicles in the body. And when they are very high, they can deposit in the arteries, blocking them. And then when you get no flow to certain arteries in the heart, you end up getting a heart attack. Now, the other thing to note is that unlike the Western counterparts, heart disease starts to go up at about 50. In India and in Southeast Asia, it often happens at 40. And we've known that for a while. Why all of a sudden are we getting 20, 30, and 40-year-olds coming out? I think there's a couple of factors. My guess is this has been going on for some time. The ability to broadcast this with different types of media, particularly social media, is wider. So we're actually recognizing what was already there and becoming a little more cognizant of what's going on. The second thing is, in moving from an agrarian to an industrialized society, our eating habits have changed, our socialization has changed. The amount of tobacco use has not gone down completely. Trying to combat heart disease, it has to be a campaign of awareness and access to world-class evidence-based international standards. And that's what we've championed along with our partners. And India has some great docs, great hospitals, but it's not uniform in that in the rural areas, we have 1.8 million doctors, of which 1 million are allopathic. And of those, only about 2% of the MBBSs make it to the rural areas, which is 70% of India. And in the 30% metro, in the US, we would count door to balloon time, meaning the time you hit the ER to the time you go to the cath lab and get an artery opened up. In India, it's your door, rickshaw time to another door, then being evaluated, then getting the right care. And since it's not uniform in terms of facilities, not every facility has the ability to take care of everything. And so I think as we grow as a country, this has to be one of these high-level mandates that we should democratize how people get healthcare, and that everyone should have the ability to get the type of healthcare which is expected. And part of that is teaching people what the expectations are and how to deal with it. A lot of times these are fads and they trend. And, I have spoken about this on my channel, that all of these fad diets work to compound or to treat obesity and whatnot. The real problem is, how do you maintain it? Number one. Number two, what you see is not necessarily what you get. You have to read the labels and you have to be educated. And I struggle with this sometimes, just like you do, that the infodemic is alive and well. I mean, this was something in the pandemic, which we saw, and hence we created the YouTube channel to give evidence-based links to what's best. And, the idea is we need to start a dialogue on health together and a grassroots movement where we're looking after each other in a way that we're family. And the way I practiced was simple, that you treated people like they were your family, and it made it easy deciding what's right and wrong. But the idea is that everyone out there is your family. We're all in this together. And I think we need to figure out a way to curate it. We're working on something like that. But I think the idea is, if you can at least raise awareness as well as use the youth's kind of activity and excitement, I think you bring the two together, and social media could be a tool for good, provided it's curated the right way by the right experts and with good evidence-based links, not just, half science or something like that. The fact that there's a huge gap in numbers, and that there are too many people, 1.35 billion patients, served by less than 1 million allopathic docs, another 800,000 Ayush docs, and everyone trying to do their part. What I see is that India leapfrogs in technology. We got the 3G, 4G phones much sooner than most of the West, because we usually get it later in the game. And similarly with 5G, we're about to hit that. What's happened is, with the current government, they have talked about, basically getting great internet, both hardwire, fiber, as well as with phone systems out to the masses. And it's a very interesting topic, because when we moved back in 2011, there were only 150 million internet users, of which 50 million were mobile. Now it's gone up to well over 600 million. And so I think as people get access, this can be used as a tool for two things. One is dissemination of information and very rapid access to qualified help. The second is we can help them track their variables and bring the two together so that you have a feedback loop. And so the idea is, it's not just about learning what's good for you. It's about seeing with like a heads-up display or a dashboard how you're doing. And when you do that, look, we always have someone telling us what to do. It could be your wife, could be your mother, it could be your, your parents, someone. But ideally, we need to internalize that, and we need to make this the dialogue of this whole generation, as well as every generation above and below, so that we grow up with this. And then technology will enable that, because we'll have real-time tools which will help us understand how we're doing. So I've been working with a lot of companies and individuals, both through investing as well as through participating directly, as well as through educating. And what we decided is, look, the gap we see in healthcare, besides the sheer numbers, is a lack of awareness and a lack of access to world-class evidence-based material, which is internationally vetted. And that doesn't matter if you're in India or in the US or in the UK. Access to care is limited in many of these locations. And the amount of money spent is drastic. In India, we spend very little. 4% of our GDP goes towards healthcare. And of that, 2/3 is private pay. And in the US, it went up from 16 to 18% during the pandemic. And the corresponding mortality numbers went down. The life expectancy, it went down from approximately 78 to 80 years old down to by 2 years due to the opioid epidemic and COVID, right? So you ask yourself, how is that possible? How is it that we're serving that? What I think we need is something to empower patients and basically put a doctor in their pocket 24/7, 365 from the cradle to the grave, who's aligned with their interests. And the idea is simple, that if you can have someone throughout your walks of life, throughout your family's walks of life, who stands by you, who is incentivized to take care of you and not the business so much of medicine, then all of a sudden this changes everything. And when you look at the outcomes, you will see that all shareholders benefit. The patients get end-to-end continuity of care, which is personalized and customized, looks at their genetics, looks at their medical history, their social history, their family history, their socioeconomic background, and their goals, and allows them to navigate the medical system no matter where they are on the planet. The second thing is the doctors benefit because they lack the infrastructure in many cases to scale themselves. This was a major problem for me. I operated for a long time, from 93 to 2011. And at my peak, I was doing about 300 to 500 open heart cases, valve cases, coronaries, endovascular, AAA and ascending aorta, and robotics cases. But the problem is there's 7 billion people, about to be 8 billion people on the planet. How do you scale that reach? And because of my background in technology I had a small software company before I went to med school, I knew there were ways to use a combination of media, technology, and smart services. And the media obviously comes from our media assets and my wife's tremendous background in that and the film company we've raised, and the edutech. And the idea is simple. If we can take media, tech, and smart services and build a platform which is agnostic to how you provide care, except to say that it has to be aligned with the patient's interests and it has to provide international standards for everything. So the first part comes in raising awareness by creating properties. And we started doing that with the YouTube channel. We've got some products for OTT. We've got some other things coming out which both entertain and educate you. So all of a sudden you're thinking about your health. And how I learned this was with my kids. They would watch House MD or ER or other things, and they would come to me with questions and say, Dad, what is this? And does a heart attack really happen that way? Or is this what happens in a car accident? And what I learned was that it didn't just engage someone, on a soapbox preaching to you, but it engaged your frontal lobe and other parts of your brain. And it stuck. It created an emotional connect as well as a cerebral connect. So what we aim to do with that is to teach patients about themselves with more novel means. The second part is the technology space product is a cloud-based platform with AI and ML, artificial intelligence and machine learning, which basically takes in all your data, analyzes it, and then uses a suite of devices which give you feedback loops. So some of these I have and I wear all the time, and we're testing them. And what it does essentially is it gives you a real-time dashboard. And obviously we have to break that down. So we have different modules, a concierge module, a subscription module, and a foundation module. So we serve the whole population. But the idea is simple, that with all of that data, we can predict who's going to get into trouble and who isn't. And then the last and most important part of this is bringing together all the shareholders who participate in the care and making sure that everything is done perfectly on their end, on the patient's end, and whatnot. And so that includes the doctors, the hospitals, the clinics, the pharmacists, all of the allied health services, as well as insurance services and other things. And, we're agnostic to who is providing it, right? It could be another startup. But the idea is we're building a platform where we are always aligned with the patient and we're navigating with them through the journey of life. And so we think with that, you're going to have a huge difference in outcomes. And we've already been able, with some of the preliminary protocols, been able to basically reverse diabetes, reverse hypertension, improve outcomes. And when I say reverse, look, you're not curing them. What you're doing is changing them from a medication and drug-dependent diabetic to either a diet-controlled or very low thing. And it's always, the pool between genetics and lifestyle. And it's a more holistic way to look at things, that how do you bring everything together? And then at the same time, you use alternative means for mind space exercises to help with stress busting, as well as to improve the happiness quotients. And no one talks about that in healthcare, but I'm like, it's scary to be sick. And the idea is you need someone who can stand by you and say, it's going to be fine. We're going to get you through this. And what I want to focus on, though, is long-term happiness. How do we achieve that together?
That was a whole lot of information, Doctor. But also coming back to Pathfinders, there are also various other such initiatives or platforms that are also there in the global market. How would you say that this is, different from all such other initiatives? What is the differentiator over here?
So it's a great question. We're fairly agnostic to who does it. And in fact, we can incorporate just about any platform into ours. Our only difference is we will always align with a patient. And in some cases, they are too. And so we looked at this from a competitor analysis, and we looked both in India as well as in the US. I would say that, by and large, they fall into a few categories, right? There's some which are in the wellness space, some in the direct medical navigation space, some in the direct care space. And my only comment would be that what we need to do is ask what the patient needs and make this a design-oriented exercise where it's different for every patient. And what I would say is, as you go farther and farther along, we're agnostic to who we use as a partner, right? Instead, what we're saying is we're a Uber platform where we can plug and play with just about anything, so long as the outcomes are good. And that's the other thing in India, I'm sure you're aware, but there's no one all-cause mortality monitor. This created a huge problem in the pandemic because we didn't know how many people died we estimated, right? And even in the US, no one really knows, because there was gross underreporting, because a lot of times patients came in late and you didn't really have the time or effort to be testing. Like that, though, how many people actually died from heart disease? 17.9 million is an estimate. So what would be interesting is to take all of that data and kind of, personalize it, customize it, and say, can we change the way medicine is practiced worldwide? And so the other part of this venture is to bring in all of academics. I'm working very closely with a lot of the institutions in the US of higher learning, and trying to make this an academic exercise as well, because there's a lot of wisdom and knowledge we'll glean from this, and knowledge is power. And a lot of it you can't do otherwise, because this is all anonymized data, and the patient owns that data, not us. And so they give us permission using biometric keys. And that's a vast difference with some of our competitors. And in doing that, we don't really have as the burdens of some of the other players in this area. Finally, the last thing is sustainability. And you've seen in the last 2-3 years, people have been throwing money at startups like nothing else. The real question is, can these guys survive when push comes to shove? And honestly, in the pandemic, everyone got a tailwind in digital health. Now, the real question is, how is it going to fare? And one thing in India, which I'm clear on, is that there isn't enough care to be had, particularly in the rural areas, but even in the metro areas, the coordination is poor in many cases, right? That, where I came from, my teams had reminders and they were calling patients in and they were doing that. That doesn't happen as often here. It's usually the patient driving the medical equation. And what I think we need to do is coordinate that and bring it together. So to your point, I can go through a very detailed discussion, name every single partner and competitor. And to be honest, I don't see it as competition. I see it as collaboration. Because in the end, my purpose is simple: to give people a longer and better life. And if we can do that together, whoever the partners are, look, you build great platforms, products, and services, the byproducts, whatever you want. And we've proven that again and again, all of us, right? My goal is not to churn and just go after the wrong sort of things. Although I can tell you that as we raise and do other things, they're going to want us to do that. My goal is to show best practices and show outstanding outcomes, in which case it's irrefutable what you're doing works. And then you figure out what the business model is, which people can afford, and you figure out how we can make this work together, where every partner is taken care of. Most of all, the person in the center of the puzzle, and that's the patient. They have to be the ones we serve always. My role models growing up were always the Renaissance thinkers, because they had so many things. And for me, the day I stop learning is the day I won't be around. Every single day I learn. And the other point to make is it's a horizontal architecture in my organizations. I learn from every rank, from the top to the bottom, and I'm always listening, right? I think when you have that outlook, it improves things. We can talk, Michelangelo, Da Vinci, more of the classical guys, or more of the recent guys, Steve Jobs, Warren Buffett. I've learned from every single one of them. More recently, Elon, he's wild, but the bottom line is he's driven and he's doing crazy cool stuff. And I'm nowhere close to these guys yet, but the idea is to bring together cool people and create a universe of superheroes who can then help others make the best of their lives. And that's what I've tried to do, right? To have fun at the end of the day with all your friends. I try to bring together teams that you can eat dinner with for every day of your life and really make things meaningful for everyone else around us. But at the same time, it's something which becomes a pursuit. And, it's like this guy Winston Churchill said. He said that if your vocation is the same as your avocation, you'll never work another day in your life. I think I'm there at this point. Every day is a new discovery. And whether it's raising kids or helping my wife with something or creating health tech startups or working with the film company, we have a film that's going out to the Goa Film Festival, or doing an edutech called Dance with Madhuri, which is doing really well. It's all really, really, really interesting stuff for me. And then, the other startups which I work with, and the other creators and entrepreneurs, as well as students. We have a lot of students around, and they're kind of the lifeblood for me. They keep me going because they're always asking insightful questions and keeping me on my toes, because reminding me I'm not that smart, and that's the best part. My children are the best at that. I'm a huge science fiction fan. And so if it's casual reading, Isaac Asimov was one of my favorite authors. Why? Because he pushed the envelope and used science with fiction to bring in things. There's been other guys like Jules Verne who, realized things many, many years before anyone else did. Ray Bradbury, I actually met. He gave me an award. I won a business award when I was 18, and he gave it to me. And that was like a moment there because I got to talk with him a little bit. And trying to get into the brain of someone who wrote Fahrenheit 451 and some of the other things. I'm constantly reading. So that's one thing I would encourage viewers, that whatever you do, just keep reading. It can be short form, long form. I read Trevor Noah's Born a Crime, and we take things for granted. We take our freedoms for granted, right? And the bottom line is there's places on the planet, even now, where you don't have a choice, right? And kind of the rules and mores of the public are very different. And so always appreciate that we live in a democracy, however it may be, right? In India and in the US, and think about some of the things that could happen. And then there's other books in the business arena, which I've read, from Peter Lynch. I've read Peter Thiel's book, Eric Vries, on lean startups. I'm constantly reading on all sorts of areas. I'm a huge car buff, so I'm always reading stuff like that. I'm also reading some spy novels and things of that nature. I read Sapiens. There's so many great books out there. I've started to read some of the Indian books. Oh my God, V.S. Naipaul and some of these guys, phenomenal. And so I'll be very honest with you, Queenie. Nowadays, I don't know about you, but binge watching is what we do more of. And what I've learned is there's so many stories that abound and so many gifted filmmakers. And so this is one of the projects, right, that we have professionally, but I'm, trying to walk in my wife's shoes and seeing what 35 years in the industry has led her to, and something very different from what I did. Music is the other thing, right? That blows my mind. I didn't have an opportunity as a child, and then I learned guitar and singing later. And my kids, fortunately, have impacted from her love of music and her mom's. And in our household, we're always carrying a tune and doing that. So I say live life to the fullest. I run a family office, and when we do investments, you know what the number one thing I look at is? The people. And I would say that it's experiences over things, number one. And we put that on our timelines all the time. The second thing is, it doesn't matter at the end of the day. My hope is that everyone will have enough to eat, a roof over their head, the ability to travel, do whatever. But at the end of the day, what matters is family and friends. And the people around you that you create experiences with. And so to everyone, don't let anyone tell you you can't do something. Dream and execute. Find people who believe as you do that things can be done. I mean, look, people look at me and they say, well, you're a heart surgeon. Why are you doing all this stuff? And I say to them, look, if I could get to be a heart surgeon, which is one of the most demanding sort of professions to get to, then think about what else I could do if I turned my brain and focus. But when you bring things together and amplify it in a laser, you're focused. And if you focus on something and don't give up and find the right people around you to mentor you, and I've been very fortunate. I've had some amazing, amazing people around me. And the second thing is always be positive, right? Always look at what's good in the world and don't dwell on the bad stuff. Bad stuff will happen, but you'll learn from it. That one person once told me that things can turn to, bad poo sometimes. But from that same poo is what they use as fertilizer to grow the beautiful plants and roses and flowers. And so the thing is that if we can kind of look at our successes and our failures and learn from them rather than dwelling on them. And the last thing is, don't judge anyone unless you've walked 1,000, steps in their shoes. And even if you have, don't ever get into that, because the bottom line is that they're human and they're doing the same thing you are, and you just need to step up and help them. So that would be my advice to the youngsters out there. And, I have some great colleagues who I've learned so much from in India as well as in the US, and they're always there for me when I need that.